Mask mandates that were implemented to deal with COVID have sparked controversy and an actual legal battle for the state. But what would be the right metrics to lead our elected officials to actually lift them? Channel 2's Ron Plant spoke with a UB researcher who actually helps advise Erie County.
We need to learn how to live with COVID. COVID is not going away. COVID will be with us forever. COVID is now part of living in the world.
Grasping a grim reality from this medical doctor and healthcare statistics researcher who helps analyze the data and advise hospitals and officials like the Erie County executive, who we pressed for more definitive answers about when restrictions and perhaps emergency orders powers could be lifted. Nothing specific there with him or from Governor Hochul, who does agree things are looking up with less cases and less hospitalizations. So to Dr. Winkelstein.
I think that we can come up with those metrics. I think it's going to take a little time to come up with them. And you mentioned, I was talking about number of cases and how much is circulating, but you're absolutely right. One of the things that we have to monitor, and we'll obviously continue to monitor, is hospital capacity.
Winkelstein says the rise and fall of flu cases each year with people getting or rejecting vaccines, much like COVID, could be a baseline model for how to cope with COVID, provided there are not more dangerous variants.
I don't know of any variants that have been detected yet in the world that are so-called variants of concern that are out there yet. So we haven't detected anything yet like another Omicron type variant.
But with that flu suggestion, this point.
So I do think that masks will become a part of our culture, but I don't think that we're going to need to wear masks every day, 24/7, all the time. I don't think we're going to need to do that, but I do think that we are going to be needing to wear them at some times.
It would be more of a recommendation than the mandate, perhaps.
Again, I think this is a difficult public policy question. But again, if we're looking at overwhelmed hospitals or hospitals that are on the verge of being overwhelmed, then you have to talk about mandates.
Ron Plants, Channel 2 News.